Ever woken up with your finger stuck in a bent position? Ever heard of something called a trigger finger? Welcome to a world where our bodies can, at times, perplex us with their peculiarities. Today we delve into the realm of trigger finger, a condition that might sound strange, but is more common than you'd think. Imagine waking up to a stiff finger or experiencing a clicking or popping sensation in your finger joint. That's your body hinting at a possible encounter with trigger finger. But what precisely triggers this trigger finger? Well, it's a tale of your tendons. You see, our fingers perform their balletic movements thanks to the tendons gliding smoothly within them. But sometimes, inflammation crashes this delicate party. When the tendons in our fingers inflame, their smooth glide turns into a rough ride, hampering motion and causing discomfort. So, essentially, your finger gets stuck due to inflammation and swelling in the tendons of your finger. Now, how does one identify if they have a trigger finger? Well, diagnosing a trigger finger is typically done through a physical examination of the hand and fingers. Your healthcare provider will ask you to open and close your hand, checking for areas of pain, smoothness of motion, and evidence of locking. The key signs doctors look for include tenderness or a bump, also known as a nodule, in the palm at the base of the affected finger. This nodule might feel like a small lump under the skin. It's usually most noticeable when the hand is closed and can be painful when pressed. Another telltale sign is difficulty in straightening or bending the finger. If your finger sticks or locks in a bent position and then suddenly pops straight, it's a good indication of trigger finger. Remember, every case is unique, so these symptoms may vary from person to person. A precise diagnosis of trigger finger is important to ensure the right treatment is given. So, you've been diagnosed with trigger finger. What next? Well, the good news is there are several treatment options available, and they range from non-surgical methods to surgical interventions, depending on the severity of your condition. Let's start with the non-surgical treatments. The first line of defense is typically a combination of rest and over-the-counter pain relievers. If your finger is swollen and painful, taking a break from activities that require repetitive gripping, along with anti-inflammatory medication like ibuprofen, can help reduce the inflammation and ease the pain. Next on the list is splinting. Your doctor might recommend wearing a splint to keep your finger in a straight position, especially during the night. This can help stretch the inflamed tendon and allow it to heal. Physical therapy is another treatment option that can be incredibly beneficial. With a series of exercises designed specifically for your hand, you can strengthen the muscles, improve flexibility, and help your finger return to its normal function. If these conservative treatments don't provide relief, or if your trigger finger is severe, your doctor might suggest injections. Corticosteroid injections, for example, can reduce inflammation and allow the tendon to glide more freely. Now, in cases where the trigger finger doesn't respond to non-surgical treatments, or if it's causing severe pain and limiting your daily activities, surgery might be the best option. The surgical procedure for trigger finger usually involves releasing the tightened section of the tendon sheath to allow the tendon to glide smoothly. It's a relatively straightforward procedure that often provides immediate relief. It's important to remember that the sooner you start treatment, the better your chances of restoring your finger's normal function and preventing any long-term issues. So, don't hesitate to reach out to your healthcare provider if you're experiencing symptoms of trigger finger. Remember, early treatment can help restore your finger's normal function and prevent any long-term issues. That's all we have for today's topic, trigger finger. We've delved into its pathophysiology, diagnosis, and treatment options. Remember, if you suspect you're dealing with this condition, it's imperative to consult a healthcare professional. Knowledge is key, but the right treatment can make all the difference. And that's it for today. Don't forget to subscribe to our channel and hit the bell icon for more health and wellness content. Stay informed, stay healthy.